Thank you for that introduction, and thanks to all of you for being with us here today, both those of you here in the room and those of you who are tuned in via the web. So the topic of our workshop today and tomorrow is identifying and reducing environmental health risks of chemicals in our society. And just a reminder that the Roundtable on Environmental Health Sciences, Research, and Medicine is here to provide a mechanism for interested parties in environmental health to meet and discuss sensitive and difficult environmental issues in a neutral setting. We foster dialogue about these issues, but what we don't do is provide recommendations, and indeed, we don't even try to seek a consensus on these issues. The workshop topics today and tomorrow, we're talking about approaches to identifying and reducing potential environmental public health risks to new and existing industrial chemicals that are present in society. Successes and areas for improvement within current regulatory programs for assessing the safety of these chemicals, possible frameworks for chemical prioritization to inform targeted testing and risk management strategies, and concepts of sustainability and green chemistry that support the design and use of safer alternatives, as well as efforts to reduce the risks of chemicals in our society. And I should say, you know, on a personal note, as Frank Loy mentioned at one point in time for several years. In fact, I started in that job 20 years ago. I was responsible for the chemicals regulatory programs at the EPA. And indeed, all of these topics that we have before us today were topics that were before the EPA at that time. And that this is a very difficult and complex area that, you know, I've personally experienced, I think may come through as I provide just a bit of an overview to help to frame this first session of our workshop. And of course, fundamental to consideration of the hazards and risks of chemicals is this notion of risk that has been promulgated very much through the national academies, starting with the first Red Book on risk assessment that was produced out of the academies in the mid-1980s. And we're going to hear later in this meeting about some more recent concepts of risk and risk assessment that have been developed by the national academies. But we do know that when we're thinking about risk, we're thinking about hazard, which is the ability of a chemical to actually cause harm, exposure, the amount of dose that might be received at target tissue, and as well as modifications by various susceptibility factors such as age and stage of development, gender, genetics, nutrition, and comorbidities. There are many individual issues that can cause variability in responses to chemicals. And that means, of course, that the availability of scientific information is fundamental to our ability to understand risk, and it's also fundamental, therefore, if we accept this risk paradigm, to our ability to manage those risks. So, as a starting point, we often hear, you know, many different numbers about how many chemicals are in society, and usually people at this point, by the way, will put up a slide from Paracelsus where, you know, he said, you know, the dose makes the poison or something like that. But I choose instead to give you this quote from Paracelsus about the kinds of chemicals that were on the market in the 15th century. And I think you can probably see that it was a fairly short list of chemicals. And in fact, that they basically lived in a world where most human needs, material needs, were met by the natural world, through wood, through metals, through other things that were extracted from the natural environment. Whereas today, we live in a very different world, obviously, where nearly everything in this room is in some way derived from chemicals. And even something like this, which is run by silicon chips, but it has to be packaged in a package that involves a lot of materials that are very complex. So the volume of chemicals in commerce it increased a lot during the 20th century. This is data from WorldWatch. But you can see that those are in thousands of tons from 0 to 160,000, and today, of course, it's much more. And the Toxic Substances Control Act was enacted in 1976. And so As the volume of use of chemicals in commerce went up, at some point in time, Congress recognized that there was a need to address that through legislation, and this was the first bill that was ever written, I think, anywhere in the world to attempt to regulate toxic chemicals. And it's easiest to describe what's covered by that act by describing what are the things that are not covered, because it's basically all substances except, food and food additives, which are regulated by FDA, drugs and cosmetics, ditto, firearms and ammunition, pesticides, tobacco, and then something that is called mixtures, although the components of those things are covered. So basically, it's a vast number of things that are covered, and it's hard to be sure exactly how many of those things there are. So I'm going to work you through some of that to try to understand how difficult it has been even for EPA to get its arms around how many of them are, much less than what they are. Okay, so the Act said that an inventory would be established and required people who manufacture, process, or otherwise use chemicals to report to EPA between 77 and 82 about these. And 82,000 of these reports, that's a rounded off number, obviously, came into EPA. And then we know that number pretty much. That's pretty much a firm number. And then over something like 20 years between 30 years between 1982 and 2012, EPA added 22,000 new substances to the inventory. So there's a requirement in the statute that if you're going to manufacture something that's not on the inventory, you need to bring it to EPA for review, and then EPA adds it to the inventory. So you could add those numbers together and say 62,000 plus 22,000, that's 84,000 things in commerce. I think that there probably are not, but that is a number that you often will see. Then EPA did a number of updates to the inventory, initially every 4 years. But those updates were not complete. They exempted small manufacturers. If they were manufacturing less than 10,000 pounds at a single site during the time of a report, they didn't have to report it. And they exempted inorganics, polymers, microorganisms, and naturally occurring chemicals. And so the full array of things that had to go into the original inventory were not in those updates. And then further in 2006, EPA modified the inventory to restrict what was updated. And those restrictions had to do with raising thresholds at single sites, on the one hand, exempting petroleum process streams and certain forms of natural gas, which I think some people today might question whether that was wise given some of the concerns about natural gas and oil exploration development, but at a time that seemed like a good trade-off because they phased in the reporting of inorganics and they added new reporting on the use of chemicals and production data for the things that are produced at truly large quantities. And they had 6,200 chemicals in the report from that update. Then they went on in 2012 to actually revise it again, this time to try to bring in more chemicals, and they are gradually lowering the thresholds for reporting, but even then it was only, and you can't see it here because it's in the blue, 7,674 chemicals that were reported in 2011. So in reality, we really don't know how many chemicals are currently in commerce in the U.S. because the method of updating the inventory wasn't designed to give us the answer to that question. It was really designed to give us information about things that are produced at higher volumes. But maximally, they're 84,000 maybe, but many new chemicals actually never made it to the market even though they were put on the inventory. And many of the chemicals that were put on the update probably never were marketed in the first place, and others still aren't marketed. One of the industry associations, SOCMA, says there are about 25,000 chemicals in commerce. I would say this is probably the lowest estimate, and we're talking about a range. That's a pretty wide range, though. And so I think if you realize that there's that kind of uncertainty about the numbers of them, that if you can't even count them, you don't actually know their identities either, right? So that makes it kind of difficult to confront some of the problems that we're going to be talking about in terms of then how do you prioritize them. So we can also take a look in terms of some of the activities that EPA does. How many has EPA ordered to be tested? So new chemicals get a 90-day review based on structure and physical activities. They're not actually tested. Some of them then are tested, but not automatically. And there are bases in the law for EPA to require testing. But the reality is very few rules have been issued by EPA to require testing. An average of 6 per year between 1976 and 2009. A voluntary program that I was involved with when I was at EPA. I see other people in the room who were involved in this. It was negotiated with industry, where those chemicals produced at more than 1 million pounds a year received screening, and the screening information was given to EPA, and I think that amounted to about 2,700 chemicals, but I'm sure Richard Dennison, who's in the audience, could correct me if that number isn't quite right. And then over the last few years, EPA has proposed or finalized test orders for about 57 chemicals, but not all of those are done. And the rulemakings have turned out to take a long time. It's very laborious. One might also ask which have been managed by EPA. By statute, several things were managed. The Congress actually told EPA how to manage PCBs, asbestos in certain uses, radon, lead, mercury export, formaldehyde in wood products. EPA for a while in the 80s was actually referring some chemicals to OSHA for management, and did refer dioxin in food packaging to the FDA for management. EPA itself did some risk management for chlorofluorocarbons, dioxin, asbestos, and hexavalent chromium, but their asbestos rule was overturned by one of the circuit courts, and since then EPA has done very little. And then EPA has tried more recently to do a chemicals of concern approach, but they've run into obstacles with pulling that through the Office of Management and Budget. How about management of new chemicals? A lot of new chemicals, relatively speaking, have been managed by EPA. More than 2,000 subjected to significant use rules, a lot of those in more recent years, the GAO found. So EPA seems to have been stepping that up. And as a guesstimate, maybe around 5,000 new chemicals that EPA has one way or another managed, including by not approving them. Management of chemical hazards is a tough area for EPA. It was the 1992 Fifth Circuit Court decision on the 1989 asbestos ban and phase out that set a very high bar for EPA to manage risks. I arrived there in 1993, so we were not exactly in a climate that was favorable for being able to use EPA's authority under TSCA to manage chemical risks. And the two things that were very difficult, I think, about that ruling, one, that they said that EPA needed to do a much more extensive substitution analysis to prove that they had really selected the best approach to managing the risks, and also that they showed a very strong preference for what I would call an end-of-pipe solution, and that is to prove that the approach they've chosen is the least burdensome approach, which can be very difficult to approve. And there have been efforts to try to understand what the public health hazards are that are associated with chemical risk, and I think this is very difficult to do. But Drs. Landergan and Tresande published a paper where they said at least $76.6 billion per year in medical care costs, not including occupational diseases, attributable to chemical risks. I don't know if this is actually a credible number. I think that it's likely to be an underestimate given the fact that we have such incomplete knowledge of chemicals in commerce. So I didn't mean to end my talk on such a gloomy note, but just to say that I think this is a very important area. It's a challenging area for not just for the EPA, but really for all of us in public health and environmental health. And it's also an area where there's a lot of room for creativity, and I'm hoping that we're going to hear presentations in the next 2 years that will help to shine a light on some paths forward. Thank you very much.